Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share. And if you're listening, do the same thing. I really appreciate it. Means a lot to me. I'm at the clinic. It's been a quiet day. Staff asked for no patients today. And I hesitated but said, okay, well, who am I to say let's see patients? So they had to catch up. Bunch of studies start up. So I'm not in the office with the good equipment and all that. But hopefully you guys can appreciate this interview because we've got John Nocero on, and he's someone I can't believe this is the first time talking to him. And
No, I'm
people
Dan,
people I
so
know
much.
very well speak very highly of you.
Dan, thank you so much for having me. And Guru Nation, thank you for having me too. Dan, this is a pleasure. I have followed your career. I followed you on LinkedIn and been on your website a number of times. I appreciate the service that you do in the clinical research industry, and the pleasure is all mine. Thank you for having me here. I'm looking forward to the conversation.
Yes, and you reached out. The timing was perfect because I had a podcast scheduled today that we had to reschedule. So it was gonna be like nothing, just go home, but instead we're probably gonna have a classic podcast because from everything I hear about you, John, you're a must-have guest, and John's LinkedIn is underneath this video and in the show notes. I guess we should just start with the elephant in the room. Are you related to Roman Reigns, or like your LinkedIn profile is like filled with Roman
Dan.
Reigns?
Oh my God! I mean, I wish. So
or are you Roman Reigns? Are you actually him?
I'll tell you what. I am his doppelganger. When I was growing up, it's so funny. I just full half body tribal tattoo. Although I do have a side piece here. I have been mistaken for him at sometimes, which you can imagine because you can see the resemblance.
Same hairstyle for sure.
Absolutely. So I have been a pro wrestling fan since I was 5 years old.
Wow.
So for me,
I used to be into it too, like back in the day.
Did you?
I felt, when I stopped watching? In 2003, like when The Rock and that, like when you remember when EW or whatever it was called merged?
Yeah, ECW came and split. Yep, and they all merged together. Sure.
I kind of stopped. Like the last wrestlers I remember was Taz. Remember Taz, that short dude, walk around like a pit bull. Kurt Angle used to be my favorite. Ultimate Warrior way back in the day. And then I stopped around that. Like that merger, it just kind of got weird. And then I think I just got busy with the research sites after that. Like I just kind of lost track.
Sure, I tell you, for me, I've always said, Dan, once it gets in your blood, it's there forever. Like you could come back in now and jump back in. People ask me about it all the time.
I tried to, but I don't know. It wasn't the same. Like I like the drama, and I know I have to invest in a few episodes before I get caught up. Basically,
sure. Well, I tell you what, the one thing I can tell you about Roman, like I am a huge Becky Lynch fan. I have been on TV with her and met her a number of times. She by far is the greatest of all time. But Roman's character arc as a performer and a person really got to me, Dan. So I don't know how much you know about Roman. So back in 2016, Roman was the hand-chosen one. And he was going to be the one that they were going to push, whether or not we wanted it or not. And the fans at that time, Dan, really turned on him. And the one thing he said, he won the 2016 Royal Rumble. And it was in Philadelphia. And you know how merciful Philadelphia wrestling fans can be. They booed him out of the building. And he said at that point, he said, imagine the soundtrack of the greatest moment of your life being filled with boos. And he never forgot it. So when the pandemic hit, I don't know if you know this too, but Roman has leukemia. And when the pandemic hit during COVID, he left for a while, and he said he reinvented himself at that point, Dan. He said, if I'm going to do this, I'm going to do it on my own terms, as me, who I am. So he came back as himself. So the extension of his tribal chief persona and now his OTC, the original tribal chief, I really identify with because that's really, he speaks to standing up for yourself, doing what you want to do. And even his key phrase, Dan, he says, acknowledge me. Where that came from, he was sitting around with the creative team and he just off the cuff, Dan, said this. He said, it's just about time I wish people would acknowledge me for my work. And they said, what did you say? And he said, acknowledge me. He said, that's it. That is the essence of what Roman Reigns is. So from this point, he's been underappreciated. He left as a beloved villain, and now he's a beloved babyface. He's getting the reaction from us that he's always deserved. So when I identify that, I see like Becky's part of my brand, Roman's part of my brand, like all of it. I always tag it with, hashtag OTC, hashtag Becky Aura, hashtag Q Kids, TMF Twins. We'll talk about all that.
When did Becky Aura? Is she a newer?
So Becky, I've been a fan of Becky for about 20 years too, Dan. So Becky really came to prominence probably within the last 10 years.
So when I stopped watching.
When you stop watching,
okay.
right? When you stop watching. But, she's another one whose career I identify with. She had a moment back in 19 on Monday Night Raw where she ended up getting punched in the face by accident and broke her nose on live TV. And at that point, Dan, she looks back at it, pivotal moment, because she said at that time, I could have rolled out and my career would have been over. Or I could keep going and just see where the segment took me. So, Dan, she was covered in her own blood. She was bouncing through the whole arena. She took out a whole group of ladies with a chair. She ended up going to the top of the arena, held her arms out, and literally I was watching on my couch, and I said, oh my God, I need to be her. Like, that was the moment, right? All of us have a moment, and even when you're fandom, like you look back at, let's say, Ultimate Warrior when he beat Hulk Hogan back in WrestleMania 6, he pinned him, and you're like, oh my God, that's my guy, right? Yep. That was the moment for me where I said, oh my God, she's my girl. I call her my Shiro. So, we all have that moment like that. It gets into your emotions.
Man, for me, it was Ultimate Warrior, Kurt Angle, The Rock for a while, like everyone.
Sure.
Also, this random dude named Red Rooster, if you remember.
Terry Taylor, absolutely. Terry Taylor. Mm-hmm.
It was one of my favorite dudes back in the day. What do you think are some, back to Roman Reigns,
sure.
some lessons from him that you've applied in your career or maybe are applying today?
No, 100%. Sure. So one of the things he said, Dan, and I watched a recent biography of him on A&E, and one of the things he said at the time, he said, it's a quote, give me my flowers now, not while I'm gone. Respect me, respect my work. If you don't, I'm just going to take it. Which means, to me, Dan, he stands up for who he is now. He knows who he is. He's elevated his whole family, his cousins, Jimmy and Jay, the Usos, their brother, Solo Sikoa, Jacob Fatu, who is in here now, his two Tongan cousins, Tama Tonga and Tongaloa. Bloodline has been the story for the past 3 years, and Roman has been the centerpiece of it. So, at all the point, you look back, Dan, he's main evented 7 WrestleMania main events. He's held his title 1,316 days. He is the box office attraction. And now, even from a stock perspective, when he first was there, Dan, WWE stock was $1. Now it's $125 a share. So you look at it and you say, okay, Roman's the guy. So when you think he's done? You look at all of that. Yeah,
who do you think impacted more, like him or The Rock in recent wrestling history, I guess?
Okay, this is me. So because I grew up in the 80s, Dan, I always look at Hogan as the guy. Without Hogan, we wouldn't even be here, right?
He's already Hogan's Michael Jordan. The question now is who's number 2, number 3?
Who's number 2? Well, here's the interesting thing. So this past year, Rock came back, and he was going to have a match with Roman at WrestleMania. But the fans pushed Cody Rhodes. So the fans ended up saying, okay, Rock, you're great. Glad you're back. We don't want you, though. We want Cody. So it ended up where Rock teamed with Roman at WrestleMania versus Cody and Seth Rollins. And then the next night, Roman main evented versus Cody. So Roman main evented both nights of WrestleMania. So I think that tells you who the biggest star is, right?
You think he's got a career in acting after this?
He does. Here's why I say this. So when the pandemic hit, Dan, they were forced to change. As a wrestling fan forever, you know how integral the audience is, right, of participating in the show. When the pandemic hit, they ended up moving their shows to the Performance Center down in Orlando. And with that, they had a number of video screens, right, for the audience to be there. Now, it's not the same. The sound isn't the same. Roman reinvented himself. He started to make his character more thematic, more cinematic. He started to talk to the camera a little bit more. If you ever watch him, his movements are very slow, like they're supposed to be. They're calculated. So when you look at it that way, do I think he is? Yeah, because he's cinematic now.
And
I'll
you're
link a couple things in the post, Dan, when we put it up. I'll link a couple of his things so you can see them.
Yeah, no, and if you guys and gals, you go to John's LinkedIn underneath the video or in the show notes, like I said, I mean, you'll see,
Sure,
Roman is all over the content. You got an article here,
absolutely.
brick by brick.
Brick by
Um,
brick. No, yeah, and I tell you what, Dan, thank you for reading that. That was
yeah.
written. Nicole and I wrote that. I've been writing with Nikki for the past 7 years, and how we wrote it was interesting.
Wait, is Nicole your business partner?
So I almost have two, Dan. So at this point, I have two. So in the Q Kids, I write with a woman named Andrea Bordenero. She is a school teacher in Willoughby, Ohio, who I consider my business partner.
Okay.
Nicole Nikki is so interesting, Dan, because Nikki and I met back in 2017, just out of fluke. We were doing a networking call, and I had asked her, I said, hey, what's your biggest regret in your career? I don't know why I even asked her the question, Dan. And she said, well, John, she said, I've always wanted to write, but I've never written before. I said, okay, Nick, well, guess what? You're going to write. She said, what? I said, we're going to start writing, because my undergrad is communications. I love to be able to do that, right? So Nikki and I started writing, and 600 plus articles later, here we still are. So it was one of those, funny things. Yeah, and I'll tell you, here's an interesting thing, a fun fact about Nick. We've never met. We've never met in person.
But how did you meet? You said a networking event. A networking event?
Well, like just networking. Yeah, like it was just networking. Like I had moved. My career had me in Cleveland for probably 7, 8, 9 years, Dan, like for a long time. And I went down to North Carolina. So I moved down there. And at that point, I looked at my LinkedIn network, and I didn't know anybody outside of Cleveland, right? So what I said was, gosh, I at the time didn't know how small the research industry was. But, I thought it was so vast. So at that point, I was reaching out and connecting with people. And Nikki was an administrator at a CRO in upstate New York. So when I connected with her, I have New York roots. So that was the connection. I was like, hey, dude, like, do you want to just connect and talk or whatever? And she said, yeah. And I wanted to add her into my network. And I had no idea it was going to turn into this. So a lot of the best things that you do are certain, because to me, we have a very unique niche. And I'm so interested in your take on this, Dan, because I know you've been in the industry a long time. So Andrea is a first grade school teacher in Ohio. And when I connected with her, she and I were talking about research education. And what I always said was this, Dan. I said, I have been in education and training and compliance a long time. But I would benefit for partnering with you because you build curriculum, right? That's what you do. You are an educator by trade. Most of the educators that I've always seen or been a part of always put an education program that's really nothing more than an SOP list that you check off. So when I was talking with her, like, tell me a little bit more about your classroom. Tell me about what you do. And she does this very cool thing, Dan. She's an expert in the zones of regulation. And what that is basically how her kids are feeling in any moment and every day and how it impacts learning. And I said, wow, isn't that interesting? Because we have a similar thing when we're out talking to PI, talking to CRCs. They're in stressful situations. Can we get a read on their emotions as well? Like really enhancing your emotional intelligence. So the more I talked to her, I was like, you know what? Like this would be ideal to partner together. And I tell you, Dan, I don't know of any other quality and regulatory professionals that partner with an educator that have a real true eye on research, education, and training. What say you?
I mean, I think it's great. I don't think it's been done in our industry. As far as I'm aware, I know there's a few vendors that, like hiring instructors. I have to actually think because the one, like we do CRA Academy, we have CRC Academy, and then we have the new one, Site Owner Academy. Those are all the instructors there are real life practitioners first, and so they don't have any background in education.
Sure.
They're just practitioners that have developed the skill of teaching after doing a bunch of
Hmm.
training on site. But to start from the other side is probably valuable because
Yep.
you're more conscious maybe about the learning patterns of the students. And I know
Yeah.
there's a few other organizations that try to do this, like with nursing. If there's any overlap, it's going to be with nursing. There's a company called Vitaleaf that does this.
Yep. Hmm.
They're a SOS sponsor, or maybe a SOS sponsor, but they come to SOS, and
Okay.
hopefully we'll get them as a sponsor this year. I think they're the closest ones to like what you've described that I've heard of.
Sure. I'd say, Dan, if Andrew and I can do anything for you or assist with that, we would love to. I think that's the biggest thing, right? Is that we have such a passion for the industry. As I say, most of us who got into clinical research didn't get into it intentionally. We kind of fell into it and we found
Yeah.
out we really liked it. We're really good at it. So the fact that I'm able to partner with a real life educator in terms of building curriculum, how we do it, she's got now a knack for education and training on the research side. I'm very lucky. And, as I look at it that way, if there's anything we can do, we'd be happy to.
The people I talked to, speaking of the educators, Judy Galindo.
Sure.
You've
Yep.
you spent 11 years, maybe 12 years at the premier central nervous system disorder site.
Yeah.
Uh,
Absolutely.
Seagull trials, right? How long did you spend
Mhm.
there?
I was there. I was a little over a year.
A little
My
over a
career
year.
spanned a lot, Dan. Yep. So I've been to academic medical centers. I've been to large healthcare
Cleveland
institutions.
clinics.
Yep. CROs. So I think for me, that was a calculated move because people ask me all the time, Dan. They're like, "Wow, John, you move around a lot." And one thing that I say, Dan, and this is me, is that while you may appreciate my career, you don't love my career as much as I do. At least you shouldn't.
Yeah.
So back in 2017, where I was at the time, I said to myself, okay, this is where I want to go. How do I get there? And really, Dan, I sat down and made a list, right? I need this skill. I need that. I need to go to a CRO. At that time, I was living in Durham, North Carolina, which is the heart of RTP. And I thought I'm like, maybe I'll go to work for IQVIA or PPD or one of the big boys on that side. I had no CRO experience, so I had to go get it, right? And when I was there, I was very lucky. I told my director in terms of what I wanted, like what my long-term path was going to be. She supported me in that. She gave me a lot of opportunities to grow. Parlayed that into moving over to a startup, and then went over to pharmacovigilance software. Landed at a lab. Like I was always determined, Dan, to bet on myself, right, of what I was going to do. And people can ask what it is, and I believe this: if someone tells you they want to make $100,000, no, they don't. They want to make $100,000 doing exactly the same thing as they're doing now, changing nothing, having the same commute, living in the same house,
Mm.
whatever. That isn't realistic. That just isn't. So when you think about the skills you have to get and gain, you have to be able to move around because that's the only time you can really get it. And to me, companies can ask you, right? Hey, you move around a lot, but then if your position gets eliminated, they'll put someone else in your position tomorrow. So where's the loyalty lie? To me, the loyalty has to lie with me. So
Yeah.
that's the way I've always been, Dan. I was talking to someone today and I was telling them like who I've been for the past 7 years. I don't know if you like sports. I'm guessing you do.
Yeah.
I am the high-priced pitcher that you go get at the trade deadline to win the World Series. You give me the ball at Game 7. I pitch 8 scoreless. I hand you the trophy at the end, and then I move on. Like, that's really what I have been. So when you identify that and you know who you are, it's much easier to do. You know what I mean?
Yes. And one of the things you said that resonated, everybody wants
Sure.
X number of dollars. And you
Yep.
said, no, they don't. They want the things to be the same, but somehow
Yep.
make more. This is so true.
Always.
I think,
Always.
like, I've been studying Stoicism lately, and it's
Okay. Me
actually,
too.
like, okay, good. So Marcus
Me too.
Aurelius, one of the things he says
Of
is
course I do. Of course.
everything changes. Like, nature moves, time is like a rapid moving river, something like that. I'm butchering what he wrote, but basically, we are so afraid of change. I've seen people with my own eyes
Mm-hmm.
self-sabotage to the point where
Oh,
they prevent themselves from getting increases in pay because they're
yep.
afraid of the change. I've seen
Dan, I
this.
was that cat. I was that guy.
You
Dude,
were this
I was
guy?
that dude.
When
Dude.
were you this
Yeah,
guy?
let's go there. Man, I was that guy early in my career, Dan. I was afraid of my own success a lot. Like, because, Nikki and I just wrote a piece on imposter syndrome, and I was writing it, and I was going through my career saying, yep, I was afraid to do that.
Hmm.
A lot of times people do. It's not that you're afraid of failing. You're afraid of succeeding and being found out that you don't have the skills that people think you do.
Hmm.
So, you look at it and you say, oh my God, what now? Let's play small. And probably when I found my real why, like a couple years back, that was me saying, you know what? I'm tired of being small. I'm tired of doing this. I'm going to be who I am. I now am raw, unapologetically me. And I am not for everyone. I know that. And you know what, Dan? I don't claim to be, because to me, it took me so long to get comfortable in my own skin. Once I finally got here, I'm like, dude, I'm not turning that off for you. I'll just go find another room. So when you talk about Marcus Aurelius, right, you talk about stoicism. Really, the only thing you can control is your response to the situation. And I think many times people try to control the situation, right? And that's where they go wrong. It's right. It's
You're
learn to
right.
manage your emotions, right? Learn to manage your emotions. Learn to handle it. If you ignore reality, you ignore the consequences of ignoring reality.
Well,
So
you see
all
this
of
all
those
the
things, right,
time.
are really staying into it.
You see this all the time with coordinators that say they want to
Yep.
be CRAs, and
Mm-hmm.
there's some that do. I would say maybe
Mm-hmm.
half. It's very common career trajectory for a CRC to be a CRA and then come back to the site. And they realize, you
Yep.
know what?
Yep.
It's not all about the money. I'll make a little less here, but it's just not this radical change in my lifestyle, because CRA
Yep.
is a radical change in most people's
Huge.
lifestyle. Like, that's not a normal
Huge.
life to live
No.
for CRA. Yet coordinators who are stable, like at a clinic like this one,
Yep.
they don't do any traveling. Go home, come to
Nope.
the site. Go home, come to the site. CRAs, they wake up, I talk to them, they don't know what city they're in half the time.
And they think it's glamorous. People think about
Yeah.
that lifestyle as glamorous, right? And, I've traveled a lot for work. And for me, Dan, it's interesting because, you go somewhere, you're in a hotel room, you may get a chance to get a good meal. You generally don't. You're going to the site, you're writing stuff up, you're coming back, you're going to sleep, you're making sure you get your rental car, you have your reservation leaving in like 2 days. So you're working through that stuff. Most of the time you work in the hotel anyway.
Yeah.
So most of the time what people see is people see the money. Oh, wow, I'm making so much to be a CRA.
Yeah.
But it's the same thing is you have the money, but you have to be able to sacrifice some things for the money. Like you don't get a home life. Like when I was much younger and I really prioritized my career, I knew the sacrifices, Dan, I was giving up. I did. And one thing that I say is if you can accept the consequences of all the decisions that you make and know that those consequences have consequences themselves, then giddy up, right? Then do it. But you can't accept something and then want it to be different and wonder why, because you didn't think through it all the time. It's like the guy who gets a raise, goes out and buys a Bugatti, and then comes back to you and goes, Dan, listen, I need more money. Well, why, John? I bought a Bugatti. Dan, that's not my fault. That's right. That's mine. So you have to learn how to manage it, and it includes managing everything.
Yes, I think that might be the title of the videos. You don't want more money, and what you want is things to stay the same in your career, but make more money. You don't want to
But
earn
make more money.
more money. I
Absolutely.
think so, man. Even as a site owner, I don't think I've ever dealt with imposter syndrome.
Okay.
Maybe the closest thing I had was when I was a contract CRA. I was brand new on an oncology study, never been in oncology, even at the site level, and they threw me
Okay.
in as a contract CRA for a breast cancer study. And maybe I had imposter syndrome at the SIV because I had to present in front of all these academic
Sure,
MDs and they were asking tough
sure,
questions. I felt a
sure.
little bit of it, but for the most part, I've been lucky enough not to. But this changing your lifestyle thing is important because you don't have to say yes to everything. Like there's certain studies as a site owner I say no to because I know us as an organization, we would have to completely change how we operate. And to me it's not worth it to do that. Number
Agree.
one is like vaccine studies. I usually say no to
Yep.
those because in order to be a
Okay.
successful vaccine site, you've got to
Mm-hmm.
high enroll. And we're used to like
Yeah.
randomizing 10 people in a diabetes study, 8 people in a COPD, 5 in a
Mm-hmm.
depression. We're not used to like 300 people in a vaccine study. So we'd have to
Sure.
completely change our identity to do that. So those now I can make more money doing that, but I
Absolutely.
I choose not to because that's not who we are as an organization. I guess that's the closest thing to this. You
Well, that's
say you
true though,
want
Dan.
more money, but you really don't.
Here's what you do though, and here's one thing that you guys obviously do very well is that you know who you are. You know the studies that you take that you can run. A lot of places don't do that, right? They'll take the study that they know make a ton of money. Oh, we'll figure out how to operationalize it later. No, that's a terrible idea, right? It's one of the things like when you talk about not just the startup process, Dan, but even the whole intake process. Like, why are we taking this? Like, really looking at the schedule of events, really breaking it down and saying, can we really do this as it written? Like, are we going to have excessive deviations? Are we going to able to enroll? We're going to able to have the visits as written. So many times people don't think of that. They just think of the long term. We take a study because it's a great relationship with so and so. Yeah, but if you jack up this study, you've just fractured the relationship. So you
Yeah.
better be able to run it exactly as written. And I think one of the things I've always done, Dan, especially from a quality perspective, I know this is going to shock you. I'm not the quality box checker. I know that's different. But I've always been the guy that partners with ops, right? Because I've always believed that if quality partners with ops, I have an idea of how the operation's going to run, and he has an idea of the quality safeguards that you put in place to make sure that the studies run effectively. They're not parallel; they're really partners. Like when you look at it that way. But for some reason, quality always has gotten the adversarial rap. Like you put quality in the same breath as like regulatory. It's not, especially if I'm in house. Dan, if I'm working for you and I'm your quality guy, dude, you pay me. Why am I adversarial with you?
You
Like
know
that's the
why?
thing. Like people miss that. People miss that,
There,
dude.
well, so even at small organizations, there was the previous site that I ran before moving to
Okay.
Yuma. There was we got to about the size we are here in Yuma, and we
Okay.
had a quality assurance person that was on site, and she
Okay.
was the most senior person there. She graduated from being lead CRC to QA. I put her in place. And then we had all the
Okay.
newer coordinators come in, and by the first year of the new coordinator's experience, they feel like they know everything. So
Oh
it's not adversarial until that.
no, I tell you what, you talk about it from a change perspective there. Like I really believe, Dan, that when people come into an organization, they go training and onboarding. No matter what it is, let's take the CRC role. If a CRC is out for the first time doing a visit and they run into difficulty, the CRC is always going to fall back to the basic level of their training, no matter where they got it, right? If they got better training 2 jobs ago, that's what they're going to remember because they're trying to get through that visit. So I think some of that can be tapped back into education and training programs, really from that perspective. Are we 100% sure that we are equipping the CRCs to go out and do their job as effectively as they can, as our organization wants them to, according to our policies, procedures, and according to the regulations? While at the same time, do we give them the support they need? Like, I don't know how your site runs, but to me, clinical research has always been the ultimate team sport. So the relationship between the PI and the CRC and the administration, all of that, really impacts enrollment. It impacts how AEs, SAEs get signed. It impacts protocol deviations. Like if there's a break in that relationship, you're going to have a problem. So
Oh,
a lot of it goes back to, fit and placement. Like you could be a great CRC, Dan, but if you and I don't get along and I'm your PI, you're not my CRC. But that's what people try to do, right? Is jam that in there. So, one thing that I learned, right fit, right seat, right time. And sometimes it isn't that, but you have to make sure you put the right fit together because ultimately you're all to site together.
Well, what if it was the right fit at the right time and then people just stop liking each other, which happens a lot?
Well, I'll tell you what, that's funny because that does happen. I don't know, I've worked with that guy, Dan. I think some of it then is too, you look at it and you say, how did the relationship get broken? Where is it? I am not a guy who's ever been all up in his own field. When I'm at the workplace, it's what is it that we're doing? Why are we doing it? We're all in it for the same reason. However, I also know that there's some people there who are amazingly emotionally invested in everything that they do. And at the same time, if you're doing a study, Dan, and you're the CRC, some people really find that identity in that, right? How they do things, why they do things. And if you criticize that, they feel like you're criticizing them. But
Yeah.
as I have said before, you're not telling me to go jump out the window or play in traffic. You're telling me to get better, like a specific skill. Get better. That's what I'm being told. So I think there's a lot of it perspective like that, and some of it is the way you talk to people, right? Some people just have that way. Whether they talk down, whether they're authoritative, whatever it is, and they rub people the wrong way. They just do. So
is it possible to change that?
What's that?
Is it possible, as a site owner, if you're noticing that dynamic in your company?
Sure.
And I may be asking for a friend, but
okay.
Is it possible to change? Is it possible to teach someone how to communicate better?
Yes, but I tell you what, some of it is the difficult conversations that you have to have. I'll give you an example. So when Andrea and I first paired up, one of the things I knew was that he didn't have a background in clinical research. But I couldn't go in, Dan, and just tell her, right? I had to give her an idea, give her a framework, have a safe space where we could build, where she could ask me, where she could feel like, hey, John, can you explain to me what a protocol is? John, can you explain to me why AEs and SAEs are important and how we educate on them? Right, that way. So I think a lot of it is that. And Dan, that takes time, right? That is having difficult conversations, which no one likes to have, but they're so needed, right? Some of the issues happen at a site is because we know what we're really thinking. We're just not saying it. If you and I are working together, you and I are going to go behind closed doors. We're going to shut the door. We're going to talk. We're going to come out unified front, regardless of what it is. I'm going to make sure that you always stay face in front of sponsors, in front of monitors, in front of auditors, inspectors, because we're on the same team. We may disagree, but we're going to do that in private where no one sees us. It's called creating safe spaces, right? That's really what it is. So that, again, is based on site culture and how you can do it. You can tell your friend it's definitely possible to do. Happy to help you with that if you need that. Happy to help.
It's something that I think a lot of organizations are going to start struggling with, especially as site networks consolidate more.
Mm-hmm.
My own site, Yuma Clinical Trials, we're looking to be the platform. We're going to probably announce it soon, but we're finalizing a couple of things, and we hope to be the platform for where other sites can join our network, and that seems to be like the trend. I didn't want to be an add-on site. I wanted to be either remain independent, or if I'm going to go the network route, build it myself. With the banking,
absolutely,
PEs out there that want to do it. They have John. There's so much money in this industry. The problem is the people who are giving it up. They're not stingy, but they're very picky about who they want. And
agree.
The majority of people don't get it, or need to find another way to get it, because the people on the other end, they'd rather not spend it than give it to the wrong person. From my experiences,
I tell you what, anything. Someone asked me the other day what word I used to describe myself. I said disruptor, right, at first. So if you ever need anything with that, we should talk about that, because I totally agree. There's so many things, right, that we can do from a clinical research perspective. It still amazes me sometimes that, all of us post on LinkedIn all the time, but yet we don't have the meetings like this where we can just be open and honest. Me, you, Nikki, Andrea, Angela Roberts, Sean Hervey, like get everyone together and be like, listen, this is how the Avengers formed. Like, why is it that we don't do that? But we should, right?
Save our sites. We're really trying. Should. Save Our Sites was our attempt at that, and we had it, our first one this year. Hopefully, we'll see you at the Oklahoma City next year in March. But saveoursites.com for everybody watching and listening. That's our attempt at doing that, and we're gonna try to make it more than just a conference. But right now it is just a conference. Every year we do LinkedIn webinars and roundtables and things like that. But eventually we'll make it into like what SCRS is, ACRP, or at least what they're supposed to be. Because I don't know how you feel.
You don't need speakers, Dan. Happy to do that. Like happy.
We will.
Speakers for any of that? Yeah, 100%.
Maybe there's a couple of topics, so let me go through some of them to see which one. I already have a few in mind for you, like possibly.
Okay. What do you think?
Scaling your site past 1 million.
Okay.
There's another one. There's one about not about site networks, but about, let me pull up the article. Here we go. Our roundtable that was in September. Hey, you tell me which one you like. So far, maximizing social media for site success, scaling beyond 1 million, site reputation management, patient recruitment and retention, site networks and new treatment areas, negotiating contracts and budgets, employee retention. It's kind of what we're talking about now. Employee retention, keep your team engaged, tech innovations and AI integration, insights from monitors and FDA experts, engagement and networking. You can probably do a couple of them.
No, I would love to. I would love to do the networking piece. I would love to do the social media piece. Because I think, again, like with that, we look at it, Dan, from that perspective. It's such an untapped tool. And I think so many people have tried it. Oh, we put it on Craigslist. Did you? Why'd you put it there? Well, that's what we thought it would get the most. So you have people in marketing that really, I'm sorry, don't understand marketing. Like you have to go where the participants are and go to participants, as far as I know, Dan, aren't just trolling through Craigslist. They just don't. People troll through Craigslist from other things. You can edit that out if you'd like. No. But at the same time, like
we'll make that as short.
Thanks for that statement. Like you look at it from that perspective. So you just think, like, what is the enrollment strategy, Dan? Right? Like, what is the enrollment strategy? What are we trying to do? And it goes back to the question you say at the beginning: how are we taking study? Oh, do we have the patient population to support this? Like, do we really? Okay, if we do, where are they coming from, and how are we doing it? Is social media part of our enrollment strategy? Oh, it is? Okay, where are we going? What avenues are we using? Who's doing it? How are we doing it? Is it email blast? Is it multiple? Are we sure we're getting clicks? All of those things. Like, people come up with the idea, but I really think this, Dan. I think it's not the idea that fails, it's the execution. You need to have the right people that are doing it.
Yeah. It's always execution, because there's probably multiple different ways for success. There's whether it's a site, whether it's a career. You and I both personally know sites and individuals that have all achieved similar outcomes, taking completely different paths. So it's not the idea, it's always the execution. And I think it's more how philosophically in tune you are to your idea, meaning how can you be compliant with the execution part of it? Because the idea is one thing, fine. Everyone has ideas. But how do you actually make it to where you're compliant, you do it, it starts generating the outcomes you want, and then other people buy into it? Because you can't really do much with just yourself. You need other people to help you out, even if it's developing your own career.
No, I tell you, what's interesting about that, from a quality perspective, I've always been this guy. So if you come to me with a problem or a question, I always assume, Dan, this is what you're telling me. John, I want to do it like this. How do I do it like this and still be compliant? And some people on the quality and regulatory side, they've always lived as Dr. No in the land of no. No, we can't do it like that. We just won't, right? We just won't do it because it's too much work for you as a quality professional, right? Just tell the truth. But for me, it goes back to, yes, you can do it. The pandemic taught us that. Like things are so different and how they would change. You can really operationalize something if you think through it. So I have always been a quality guy who lives in the gray. Like I understand black and white. I understand you're not supposed to do procedures before informed consent. I get that. But at the same time, you think about e-consent. Can we do it? No, we can't do it. Well, really, you can if you operationalize it right and you think through it and how you're going to do things. But again, people either don't want to invest in learning it, they don't want to invest in the time, any of those things.
Yeah.
It's just easier to say no.
It's easier to say no. It's safer to say no because at least you
Mm-hmm.
know if you say no, things are not going to change. And if nothing
No.
else, but things are not going to improve necessarily either.
Mm-hmm.
Your time with Siegel,
Yeah.
again, shout out to Judy Galindo. You said research is a small world. I agree.
Very much.
What's even smaller is central nervous system research. And
Uh-huh.
I got my start in that 2000. That's probably my bread and butter is psychiatry studies. Even here in Yuma,
Okay.
I thought I wouldn't do
Yeah.
them. We're doing them. We can't escape psych, man. Psych is always in my career.
Yep.
But you were at the pinnacle of sites,
Yeah.
Siegel,
Absolutely.
for about a
Yeah,
year.
absolutely.
Recently,
Love them. Love them. Shout out to Bonnie. I love her dearly.
what are some of the things they've done really well that you think other sites might be able to learn from and emulate?
Dan, I think the culture is great there. I mean, that's part of it, right? When you have leadership that believes in what it is that you're doing, like Bonnie loves the company like it's her own child, and I say that with as much respect and admiration for her
Is she a
as I
psychiatrist or
can.
who's Bonnie?
No, she's the president. Bonnie's the president. She runs the company. She founded the company 28
Ah,
years
okay.
ago.
So she's a
Yeah.
site owner.
So
She's not a PI.
oh yeah, she's the owner,
Okay.
100%. And Dan, she walks it just like she talks it. So to me, like when you look at it from any company, it's always top down, right? If you have that culture and you buy into it and you lead by example, right? And you do that because all of us, Dan, have worked with a guy, and I always use the quality guy as the example. You have the quality guy who's in a white hat and a white cowboy outfit, and he's on a horse, and he comes in. He's a huge cheerleader saying how we're going to change everything, and I've been waiting to get in here, and blah, blah, blah. And then 90 days later, he knows that he doesn't know what he's doing. But also, he knows that you know that he doesn't know what he's doing. Because he's all smoke and mirrors, right? He's all sizzle, he's no steak. He's all bluff, he's no stuff. Looks like Tarzan, plays like Jane. Whatever you want to use. So for me, like you look at it from an example perspective, you have to walk it exactly like you talk it. Like if this is the culture you want to build, it starts at the top down, and you bring the people in that cascade your message, that believe in what you are doing, and you change the culture that way. Because if you're going into an organization, Dan, like if I'm going into your site, I think I'm going to change the culture. I'm totally wrong because chances are I'm going to end up becoming like your site. I assimilate into what you guys did. That's basic human physiology. That's basic psychology. That's what happens.
Right.
It turns into that. But if you have a vision, you hire the right people, you want to get the right people in. That's totally different. And you get the people that buy into your vision and they cascade it when you're not around, and you're a site director and I'm cascading your vision permanent, across the board. That's powerful, man. That really is. And it's leading by example. So when you're not there, you're really there.
Yes, I'm trying to get there. I think we're close. This is a
Okay,
3-year-old company. Bonnie's is like 30 years, or
Yep.
20 at least. What does she actually? Does she still run it day to day?
Mm-hmm.
Still
does, and it still does. And I tell you what, she has a great leadership team underneath her, but ultimately she's very visible. She's there, and that makes a big difference. That really does.
So she's there every day, or she's there like some of the days, or how does it work?
She's got a presence. She definitely has a presence there, Dan. I know she's done some stuff remote as of more recently, but she definitely has a presence. And that's the biggest thing, right? Is that you have to feel like you're there. You have to feel like, as a site owner, like I'm there, like I'm with Dan, right? Dan is here with me. I'm cascading his message. I'm his right hand. Like, as you look at those things.
And
Been key.
what is the size of that organization? look like? Because I think for somebody that's, and do they do other things besides psych, or is it just psych?
That's their niche. Right now, it's hard to tell, like for me, Dan, because I was working on a specific project for the last 4 months. So I
Mm.
don't know like the long term of where they were going to go, but I tell you what, it's well vested. It's set up for success. However they want to move through things. And again, like you look around the industry and you start to say, who are the people that are most successful and why? You can even take it from an organization perspective or even a skill set perspective, Dan. Right? Of how are such and such good at what they do and why are they so good at what they do? Like
Yeah.
those are the interesting things, and it's really getting the right people at your site to be able to get those trials, enroll, do it effectively, and bring the next one in. That's very important.
Yeah, there's a lot to learn from people like that. There's,
Sure.
clearly a bunch of fly by night sites that get started and shut down. And
Yep.
then there's those staples that have been there for decades. Judy has a site like that, Sun Valley Research
Mhm.
Center.
Mhm.
I've had one that was close in Orange County, California, South Coast Clinical Trials.
Okay.
But we decided to break it up into different parts, and it had potential. And that's where I learned about Siegel, was from that site.
Sure.
We brought in a
Sure.
consultant early on, and he was a client of, it was Todd Frankum, if you know him.
Okay. Know
Uh,
of him. I don't think I've talked to him recently.
okay, this was 08, 09. I haven't talked to him recently
Yeah.
either. Uh, but he was like, you need to follow what Siegel's doing. And this was before LinkedIn, social media. I mean, you could only hear of them. Couldn't
Mhm.
actually talk to them. We couldn't. There was no such thing as Zoom, LinkedIn chat, none of this stuff. So I learned through him, he was a consultant for them, some of their best practices. And I
Mhm.
think they really, to me, they always were the benchmark for, at least in CNS, what to achieve. And
Sure.
I'm very happy to hear they're still
Absolutely.
maintaining that. And okay, and what about other organizations you've learned, like best practices and worst practices? So not just Siegel anymore, but throughout your whole
Sure.
career.
Anything? Absolutely. So whole career, Dan, I think best practices for me. One, you realize when you're at a site, and I'll just use me and you. If you're running the site, there's times where you have more information than I do for whatever reason.
Yep.
So ultimately, you realize as someone working there that decisions are being made that are out of your control by someone who has more information than you, and that's just what it is. Not everybody's voice counts. It just doesn't. Like ultimately, like you look at it that way, that the owner and operator makes the decisions that's best for the company. And that's
Yeah.
really what it is, right? You look at it
Yeah.
that way. I think the best organizations I've ever had or worked at have been open, honest communication and transparency where we've had conversations like this. I'm thinking back to my tenure at Flagship Biosciences where I had COO who I could just go into his office, we would shut the door, we would solve problems in an hour and everything would be great.
Was that a sponsor or a
Others,
site?
that was a site. That was actually a clinical laboratory in Durham, North Carolina that got acquired by Flagship in Broomfield, Colorado. And, for me, I had a great site, a great team there. I think other places I've worked in, you realize, or when you get in there, the culture isn't necessarily what you thought it would be. But again, like I look at it like this: it's like dating, right? If you complain about the culture 6 months in, then you didn't ask the right questions during the interview process. You didn't vet them right. You're the guy who's on the first date and then goes, okay, this is what our kids are going to look like. This is where we're going to get married. Here's the dog. Here's the fence. And the woman is just like, hey, I just want to have a good time right now. Like, that's really what you're doing.
Yeah.
So, from that perspective, you didn't ask the right questions. So a lot of it's like that too. People complain about that all the time. But at the same time, you realize, you know what, employee? You had every chance to ask me different questions. I didn't paint the scenario that was different. I just told you exactly how it was. Maybe you heard something you didn't think it was going to be, but that's really what it was. So I think it's always communication. It's always creating that safe space for people to have
Yeah.
those open and honest.
Like communicate,
Really,
but yes, I agree. What about
sure.
what about worst practices you've been through? You don't have to name who it is unless you want to, but worst practices.
Okay, I think this is the thing too, Dan. Again, when you think about smoke and mirrors, we have processes written down. We don't follow them though. But, you know, it is the culture of the organization not to follow them. But we can show them in case anyone comes in and looks that we have a process. We can't speak to it, but we know it's there. So anyone that puts the framework in place and doesn't believe in the framework, that's really what it is.
Yeah.
I've been lucky from a quality perspective, Dan. I've been lucky. I've never had anyone who came into work and intentionally tried to be fraudulent or have anything to do with, misconduct, anything like that. Nothing. At the same time, you look at it. Could we do it better? Sure. We could always do things better. But you have to have the organizational leadership structure in place that says we want to do things better. That's part of our structure.
Yeah. I mean, I've managed quite a few personalities in my career, maybe 60 some odd people over the course of it. There are always small sites, like 4 or 5 coordinators, but they add up, and they're different personality types, like clearly, and there's different levers that pull different people, and when you throw in, just to add more complexity, the generational differences now. So, when I started, I'm a millennial. I'm an older millennial, but there was like Gen X people. And then the millennials came through, and now we're at the Gen Z, and I'm working with the Gen Z people.
Sure.
Everyone has different personality, first of all, but second of all, different generational, I guess, proclivities. So it makes it tough to manage because, I mean, at millennial, you're still close to both sides. Like, there's millennials working, there's Gen X, there's Gen Z. I could imagine as the next generation comes in after Gen Z, I'll be older, I'll be further removed from them. I think about this, how I would manage them, and I'm not sure I would be the best person to manage. I think you would need to have directors in place that would manage the next generation. There's something about being like 2 generations removed from someone or more that makes it a challenge. I don't know if you've come across this, besides the personality types, because you seem to be a personality similar to me where you can adapt, but the generational thing's gonna be hard.
Well, I tell you what, when I was a flagship, I had 2 younger junior quality professionals, both in their early 20s. One I really clicked with, one I didn't. So I think, again, I think back to that all the time, Dan, and I tell you what, the one that I look back and learn the most from is the one I didn't necessarily click with. And I think the world of her. She is headstrong. She believes in herself. She talks about what she does is right. Like, anyone should have that sort of skill set at that age because she was so good. She was so bright. But at the same time, you've had those people, Dan, where you just clash, right? They, for whatever reason, like your personalities just don't mesh. And I think I look back as a leader and I say, I'm glad I had her for as long as I did. I have someone else who was younger, who listened, who wanted to be mentored, wanted to move ahead in their career. Ultimately, for me, when I look at that, that's just a reflection of what sort of leader am I? Who do I want on the team and why do I want them? Right? And when you can answer those questions and figure that out, then it's easier to deal with the generational challenges.
Yeah, I agree. At what point are systems just as important as the people? Like, is the goal to get the systems to where you almost don't need people or they work independently of people? That's the way I understand it, is like the perfect systems are, well, they never last forever. They need changing. But they're supposed to work irrespective of personalities or even management. What do you think about this?
One thing I learned, Dan, ready? It depends. If you need people to manage the system, then you need a user-friendly system that people can manage. People don't do that, though, a lot of the time, right? So, again, where you look at it, it goes back to What's the long-term goal of the organization? What's the system that you want to run? Like if I'm going to run a QMS, I want it configurable, but I want to be the only one to configure it. I don't want everyone to be able to do it. I know my system works, my process works. I set it up that way, and then we do it. Other times, like again, it's who has the voice that you're listening to configure the system and who's going to use it. I shouldn't be configuring something that project management's going to use all the time. But if project management doesn't have the necessary experience, then let me configure it in tandem with project management.
Yeah. So it depends.
That's one thing, Dan. The older I get, I say it a lot. It depends.
Everything depends. There's no binary.
I know.
There's no binary. Another philosopher I've been reading is Nietzsche, and lately, and I mean skepticism. If you had one word to define him, in my opinion, basically he said there really are almost no truths, like universal truths. Everything, even religion, it was created push something or some belief or some system, as in what we're talking about. So. What is the actual truth? The only truth really is that things change, and that's where it relates somewhat to Stoicism, although he was kind of against Stoicism as well. Nietzsche was a gangster guy. You guys need to read Nietzsche. He's hard to read, but you gotta. I think the older I get, the more philosophy I've been reading to try to figure this stuff out, and I come back to nobody really knows, and you just kind of have to, as prepared as we want to get, John. As there's ACRP, and I don't want to pick on any conference. They'll sell you all kinds of shit, thousands of dollars. Figure out this, learn this. It's not going to do anything because it depends. Like you said, it all comes back to it depends.
Always.
And depends on what? Depends on the stakeholders. And so that's something that you can somewhat control if you are the owner or one of the important stakeholders, like that can pull enough levers. But this stuff fascinates me because when I was younger, I thought, okay, there's a blueprint for this. And then if I want to do that, there's a blueprint for that. And at the end of the day, it's really not. Like, that blueprint was someone else's roadmap that worked for them. But their variables, there's no way I'm going to have all those variables. It's very different.
Every time.
So we are actually philosophers at this point, I believe. Last topic, as we wrap up, although we can do this for 3 hours, I mean, just on wrestling.
We could. I mean, hope you bring me back. Like, I've had an amazing time here so far. We can always do a part 2.
We'll do a part 2. We'll definitely do more interviews pre-SOS, and then I'll add you to the short list of people that should be on stage. And Judy already co-signs for you. She's one of the other stakeholders.
I'll make sure Andrea comes with me and we do something on education for you.
Okay. Networking. I think it's super important. I think,
I do too.
Especially in a time where the job market is very difficult, but the money is there. So this is a weird market because money is here like never before. So it's not a contraction in the market. The money's here. But technologies, global outsourcing, consolidation, economies of scale, all these things could push and are pushing certain people out of the flow of money. That's what it boils down to. Networking is your only defense and offense. Everybody, you, me, person without a job, the person with too many jobs. That's all. That's the only thing that has some kind of equal playing field for everyone. Yet, only a few people do it, and then from those, only a few do it well. So. I think people need to learn a lot on this.
Here's what I think, Dan. I learned the networking piece from a woman named Lisa Rangel, who runs Chameleon Resumes. Shout out to Lisa. I love her dearly. She taught me a thing when she was doing a podcast, Pretend You're Fired Today. And she had a thing where she said, Dan, network or not work, right? Because ultimately her method is this. It's called ROTH, ROTH. You know what it stands for? Reach out to humans. Like, you can specifically, right, apply for jobs. You can get your resume tight. You can do a career letter. You can do your branding, whatever. And then I secure the interview. And then you sit in front of me. Oh my God, I can't talk. Why would you want to hire me? So ultimately, it's that piece. Whether you're working, whether you're not. Like, people only network for some reason. People only network when they need a job. Why? Like, I was sitting in the beginning of this. I was like, damn, why haven't Dan and I ever talked? Like, we really should have this discussion 10 years ago. But for whatever reason, we didn't, right? So we knew of each other. We knew of each other's presence. But again, people get busy. You're at the site. You're enrolling. Then it's 5 o'clock, and then I got to go home, and I got to take my kids to practice, and then I'm tired. Then I want to watch Netflix.
Then you got to watch Roman Reigns wrestling.
You got to watch Roman the Rock, right? I'll make sure that all that's linked in here. But that's part of it, Dan, right? Like, that's one reason why people don't do it, because it feels like another thing. When you go to a conference and you meet somebody, you may establish a great relationship with them, but chances are it feels like, hey, here's my card. Do you have a job? No? Okay, great. And then you're done. But it shouldn't be like that. It's really
everyone does that too.
It's really relationship building what it is. Like, I think back, one of the reasons why, like, Nikki and I have been successful, one of the reasons why Andrea and I have been successful is that we prioritize that relationship. Like, we know that's beneficial for both of us. So we always talk. We always share those best practices. And the only thing I ever did, Dan, for either one of them was to go into the relationship to give. Like, what can I give them? What's going to make me a better partner? What can make me learn from them? I wasn't trying to take from them. It was always, okay, how do I add value to what they do? When you go into something like that and you go to give, your perspective changes. Like, if I'm coming to you, I'm like, okay, what does Dan need? Okay, Dan needs an education program. Well, let me give it to him because he needs it, not because of I want anything from it. You know, and that's the one thing, is that you talk about from a stoicism and philosophy standpoint. Go into interactions with what you can give somebody rather than what you can take from them. Because then at that point you're doing it for the right reason, right? That's why you're doing it. And that's what people, I think, need to remember. You talk about how difficult the market can be. It can be, but at the same time, one thing that Lisa taught me was, like, your network and how you connect with people and how you talk and having that ability to understand who you are, why you're that way, and what value you add really speaks volumes. Like, that's what it is, Dan, right? If you're hiring me today, if you're going to hire me today as a quality professional, this is what I'm assuming. You tell me if I'm wrong. So you're assuming, John, you can come in and you can do the job, and you're not going to be emotionally expensive, meaning you're going to develop great relationships with everybody. You're going to collaborate. You're going to problem solve. You're not going to be all about you. You're not going to be all about your feelings. You're going to be what it is that you give the organization. That's what people want. Like, if you really talk about that in great hires, that's what that is. I bring that to you, Dan, in case you want to hire me. But at the same time, like, that's really what people need to realize is that's what you're bringing every time.
And you do this now, you're consulting, or you're contractor for different sites?
I tell you what, right now, Dan, I'm looking for my next gig. I'm enjoying the time. I tell you what, time has never been a resource for me before. Like, never. So I'm enjoying that piece. I'm working out twice a day. I'm talking to people like you. I'm looking for that. You know, Andrea and I are building up our consultancy business, so we're happy to do that. Wherever it lands up, like that.
That's the part of the market that's blowing up. The consulting.
That's where we're. Yeah,
that's where the money's going. The money's going away from W-2, clock in, clock out, to value add. What values are you adding?
That's what we do.
Yeah,
that's what we can do. That's what we add. That's what we add. So, like, anybody who's interested in that, they can always reach out to either one of us, and we're definitely going to make sure we do that. So I know, Dan, we'll be in touch with you. Anyone else who hears this as part of your Guru Nation. So again, Dan, this has been such a pleasure for me to be able to sit down with you for the last hour and 15 minutes and really kind of chop it up and look at it from that perspective. This has really been a privilege. I thank you for having me. We'll definitely, as long as you're open to it, do a part 2. We'll come and present at your conference. Whatever you need, we will definitely do it. But thank you. We definitely appreciate it.
But likewise, nice to meet you. And as if this thing grows, Yuma Clinical Trials grows into a
Yep.
site network this year, we're definitely going to need QA, QC
I'm your guy.
processes.
I'll tell you right now.
Now I know. This is networking, guys. Now I know.
I will be your guy.
Yeah.
Cool. Dan,
There's
thank
a
you
lot
so
to
much.
do.
Thank you.
You so much, John. Thank you, everyone, for watching, listening. You're getting me wanting to watch wrestling again, man.
Good. I'll link you some stuff. I'm going to go share it on LinkedIn now as a teaser. I'm going to put some stuff underneath it so you can see it. Maybe I'll drop some Ultimate Warrior footage in there for you.
Ooh. Do you know what ever happened to him? Like,
Yeah,
the original guy died, right?
Well, he ended up, it's funny, he went to the Hall of Fame about 4 years ago, and the Tuesday after he went in, he dropped dead of a heart attack in Arizona. He was flying home. And it was one of those things, Dan, where, like, you think about the iconic characters to come at full circle. Like, from my childhood, he really was. Like, no one looked like him. He literally looked like
animal.
Comic book superhero came to life. He had the physique, he had the face paint, he had the tassels, the muscles.
His energy, the way he came in the ring and just shook the rope.
Crazy. So, like, you think back to those things, and what do you remember, Dan? Just tie it all into clinical research, because you asked me, like, what does Roman do? It's an emotional investment. Roman gets me to feel, you may not believe, not you, but you may not believe what he's doing is real, but you can bet he is real. That's who he is. When you know that, that is who you are, and that's exactly who I am. So when I take the letters OTC, like, that is an homage to him, but at the same time it is, I know who I am. I'm an original cat. I'm not going to change. And, I believe in who I am. So no, it's part of all that too.
Where do you rank Undertaker all time?
Okay, so you asked me about my Mount Rushmore now. Let's just say we'll end on this one. My Mount Rushmore, my 4. I got to put Hogan on there for sure.
Of course.
Because without him, he isn't there.
I don't know anyone who would omit Hogan from their
for
Mount
sure.
Rushmore.
I also will put Steve Austin on there because in the Attitude Era, no one was hotter for that long amount of time. So I'm going to put Steve Austin on there. In the in-ring, you may disagree with this one. I'm going to go Shawn Michaels. I think I've never seen a bad Shawn Michaels match. I think he's charismatic. He did a lot for the industry at a time when the smaller guys were becoming more well known. I'm going to do that.
Yeah.
And then I'm going to do a change here too, Dan. So, and no one ever mentions them, but I don't know why they don't. There was a time in the 90s where you and I couldn't go to a school or a mall and see somebody in an NWO t-shirt.
Yeah.
So I have to say the New World Order, because without them, you don't have the cliques, you don't have the gangs. And people talk like, oh, the Four Horsemen were the first. Yeah, they were. But you know what? There's a reason why people are still talking about the New World Order today. And people lose their influence a lot of the times. They never have. So people our age are still wearing them. They're still, flying those colors. Man.
X-Pac, right? Who was that? X-Pac, Triple H?
Kevin Nash, Scott Hall, Hogan was there for a while. Like, you look at it from a perspective and say, they really moved the needle.
Wow. But Undertaker is off your Mount Rushmore, man.
I mean, he's iconic. Let's not lie. He is. But is he top 4? No. Like, he's not that he's bad, but
he brought the mystery. He brought the mystery angle.
He did.
I think the only better mystery angle than Undertaker was Papa Shango. If you remember,
I do remember Papa Shango. Oh, of course I do. Charles Wright. He was
Man, you know that by name.
He finally tried to give it a click. I do.
Wow.
So
See, I gotta have Kurt Angle on my Rushmore.
Okay, I gotta tell you, I met Kurt Angle at Chillicothe. Probably now back in July, he did a conference out, meet and greet in Ohio here, and I ended up meeting him. Great dude.
Awesome.
Great dude.
Gold medalist with a broken neck or something
broken freaking neck, if you remember right.
Kurt Angle's on my Mount Rushmore. I have to put Undertaker, Hogan. I don't know, man. I mean, I would want to put Ultimate Warrior, but you'd have to put either Rock or Stone
Cold. It's yours. You can. It's yours. You can put Warrior on there.
No, because then Rock's not on there, nor Stone Cold, and you need that era.
And here's the best part. this is the best part of it. It's so subjective because it's who we like as performance, right? It's who resonates with us emotionally. So I think it's that piece, like that's so important. But again, it's one of the things where when that connects to you, then it's just part of what you do. So no, I appreciate having that. No one's ever asked me about my Mount Rushmore before.
Well, and Macho Man's missing from both of our. I mean, there's so many that, and I'm not even talking new era. I'm probably missing out a lot on Roman Reigns and um, Cena. You know, I missed
Cena.
that whole.
Andre the Giant, Dan, for God's sake.
Oh, I was gonna mention him. Yeah.
So there's so many out there. Like we'll go through that. I think that's
Jake the Snake. Jake the Snake was something else.
I'm telling you, I know.
We'd go on forever, but John, listen, man, it was a pleasure having you on here. I really appreciate it.
Pleasure was mine, Dan.
Thank you. We will be in touch. Everybody, go follow him right now. His LinkedIn's underneath and in the show notes if you need a consultant, someone with clear ClinOps experience and QA, and this stuff's going to be important, man. Quality, compliance, especially with the mergers and acquisitions. Mm-hmm. John's your guy, so reach out. Thank you very much, John. Everybody, like, subscribe, comment, share, go connect. Bye-bye.